Hey everybody, I'm Dr. Paige Hubert for Recharge Performance Therapy. Welcome to another episode of your Sunday special. Before I get started, I just want to let you guys know that this is a really heavy topic that we're going over today. So if you have any questions, feel free to just go ahead and shoot them out. I'm going to be kind of just going and blowing. If you have anything, let me know so that I can get them answered probably at the end. So once again, if you have questions about chronic pain, also we're going to be getting into pain science. I have a little bit of a visual for you guys. I'm going to be posting that in the comments later. So first I'm going to give you some stats. 1 in 5 people in the world experiences moderate to severe chronic pain. And once again, chronic pain is where you're experiencing pain for greater than 3 months. That could be really anything anywhere in your body. It could also be related to a comorbidity. So make sure that you're talking to a physician or a PT about what's going on. In the US alone, more people live with chronic pain than diabetes, heart disease, and cancer combined. That's 116 million Americans, or about 30% of our population, that is living with chronic pain. That's really significant. This is lasting pain. About 28% of that is back pain. I think a lot of it the next biggest one is probably knee pain and then neck pain, if I'm correct. Chronic pain costs our country about $635 annually, or $635 billion, annually on treatment and then lost productivity alone. So it's a very large portion of what we're doing just kind of every day in our society. What's up, Zach? So half of our chronic pain patients are reporting that they feel like they have little or no control over your chronic pain. And that's something that I know as a physical therapist I really can help with. But that's also just I don't like to see, because there's nothing that goes on in your body that you cannot affect. According to the American Academy of Pain Medicine, 59% of chronic pain patients said that their chronic pain had an impact on their overall enjoyment of life. 77% reported feeling depressed, 70% reported trouble concentrating, 74% said their energy levels were affected, and about 86% reported an inability to sleep well due to chronic pain. So if you're listening and you just heard all those statistics, that's telling us that chronic pain is not only affecting my back, my neck, my knee, whatever is hurting, it's affecting your life in general. And not only is it affecting your body, it's affecting your life, but it's also affecting the lives of those around you. I know for a lot of my mamas, that means they're having a hard time playing with their kids, they're having a hard time doing stuff at work, or some of them are teachers, so at school, or even at home, just daily chores. So those are all things that are significantly impacted by something that has lasted for 3 months or longer. For those of you guys that have had healthcare providers tell you that the pain is in your head, I'm so sorry. Your pain is very real. And if somebody tells you that it's not, they are obviously missing the boat on this whole pain thing. Your pain and my pain are very, very different. You might have a 4 out of 10 pain that might be 8 out of 10 to me, because our pain is very subjective and it's very relative. I will tell you though that your pain is in your head, like actually processed in your head. And if you didn't see my video from 2 weeks ago, I did explain pain a little bit and how your body perceives pain. So yes, technically pain is in your head, but that's not how they meant it. So yes, your pain is very real. I also want to mention that pain is, like, once again, very subjective and relative. Things like your diet, your sleep hygiene, your chemical makeup, your emotions, your support system, and just your general environment are all going to affect you on a daily basis, but they're also going to affect how you are perceiving pain. So things like getting enough sleep are really important if you do have chronic pain. But that's just all what goes into how pain is processed, and it is a very complex process. In this video today, I'm going to try my best to explain pain. And just so you guys know, pain science is a very fluid study of science right now, and it's changing, and we're learning new things each and every day. I know what we learned 5 years ago is not what we're talking about anymore with pain. So as we learn more about this, I will continue to get you guys the information that you need. Today what we're looking at is some of the newest information that's come out. And once again, just as a reminder, there are no such thing as pain receptors in your body. There are tissue damage receptors that tell your brain that, hey, something is occurring, and once again, that your brain's processing it from there. Also, for most people with injuries, if you are past a year from your injury, most of you guys have healed that injury. Now, I'm not saying that you're not going to have chronic pain, because you might from that injury, but the actual tissue itself should be healed. if you have things like diabetes, or you're just kind of slow to healing, or have some other type of comorbidity, that's going to affect where you are in the process of healing in general. So if you are kind of worried about that, or you have other comorbidities, talk to a physician, talk to a PT, so we can find out what stage of healing that you are in. So now that we've got some basics out of the way, we're going to talk about how your brain receives information, processes it, and outputs either pain or action plans, some different areas of that. So we're going here to my handy dandy chart. I'm going to do my best to kind of show you guys. So I'm going to lean forward like super awkwardly. I'm also going to be putting this into the comments at the end. So if you want to see this in better kind of portions and less kind of in your face on this picture, it'll be there. So this is our neuro matrix theory of pain. So we have what inputs from our environment and a bunch of things that go into the brain, and we have output, which is actions and sensory and stuff over here. On the bottom is time. Sorry, I have the blinds open. Time. So we're going to start with the input first. So we're going to scoot you guys closer so that hopefully we can get you a little bit out of that light. Okay, input. So we have your cognitive related areas of your brain. So this is things that your brain is learning about the environment, your body, your emotions, also your memories, what your attention is directed on, what definitions that you have placed on the world, which could be cultural, which could be religious. They kind of go on from there. They're also having your thoughts are right here. The next one you have is your actual sensory system that's telling your body or telling your brain what's going on with your body. Those tissue damage receptors. You've also got a ton of other receptors just to let your body know where your joints are in space, et cetera, et cetera. There's a ton in there. We could talk an entire video about those. And then the last thing we have is your emotions. That's actually your limbic system, and it's going to tell your brain how you're feeling currently, what your emotions are, and what hormones are there that are affecting your pain at the moment. So your brain takes all of these and it sorts it into either your cognitive area, your limbic system, so your emotional area, or your sensory area. Now, these things get kind of sorted into one or the other, but I don't know if you guys can see. Can you see right there? There's these little mini circles in here, aka they can all affect each other. So just because something is originally coming from the cognitive portion of your brain doesn't mean it stays there. I'm going to give you an example. So if the sensory portion of your brain gets a sensory information, goes to your sensory, and it's like, hey, we're having some tissue damage going on. This is kind of an issue. I'm going to tell the cognitive portion of our brain. Cognitive portion of the brain goes, this is tissue damage. This is pain. I need to tell the affective or the emotional side of our brain. It's like, this is a red alert. Hit, let's get all these things started. So now we're going from here to here to here. This kind of becomes, almost can come like a swirl. They can go any which way. They all kind of intermix. So that's why pain is kind of a very complex process, because you're not just staying in 1, 2, or 3. You can send signals in between all of them, and then go back and forth all the time. So when we have an emotional aspect, a cognitive or sensory, we kind of get out of our output. Once our brain has kind of taken in all of the information it can, it's going to start trying to make an action plan, which would be your output. So you have, your action plan, which could be voluntary or involuntary. That means that you have actual physical plans that you're going on. So if it's voluntary, you're making a decision to run away from whatever it is. If it's involuntary, that means I touched a hot stove and I'm yanking my hand back. I didn't have to think about doing that. It's kind of a pre-programmed actual motor program within your brain that is just very, very quick. The next portion is your pain perception. So when we're coming out of the brain, we have pain perception, which is actually where your body is creating that sensation of pain, that there's an issue going on. And then also we have your, in pain perception, you can also get a bit of affective and emotions that are going to be triggered by pain perception itself. The next and last part that we have is your stress regulatory programs. So that's where we are releasing your hormones related to stress, so that cortisol, and that could be related to physical or mental stress. And then you're also getting things like your fight or flight systems that are kicking in. And then, excuse me, I've totally lost my place. And you can also get agitated from the release of these hormones, and they can affect your emotions and different things of that nature. So when we're feeling pain, it's not just tissue damage equals pain. It can be tissue damage isn't really happening, but I can be really stressed, and my brain perceives that as pain in this nice little swirling wheel that we have going on. And your stress regulatory hormones are affecting that as well, like we saw on the outputs, and it's also on the input side. And once again, this is, oops, sorry, I'm turning the wrong way. This time can happen in a matter of seconds, or it can take longer just depending on your situation. Pain's super complex, and this theory is just kind of currently what's going on, and it's also happening underneath your conscious mind, so you don't have to think about what inputs am I sending to the brain and what are my next outputs out. And it obviously has a lot of factors that are going on. But the next thing is, what happens if our body is overreacting to something? What if we have a really heightened emotional state? So instead of these all being equal, what if one is really, really big and one is really, really small? Then your brain is going to perceive those things differently, and oftentimes that information might get kind of confused and lost on what's actually tissue damage or versus something else. So when you're experiencing chronic pain, oftentimes you are having a really heightened one of these and your brain is confusing it for pain. You did have tissue damage, most of you guys did have tissue damage at some point, unless you have fibromyalgia or something else of that nature. And it's since healed. However, your brain is like, that was terrible. I don't want to do it again. I now have a really heightened sense of, alarm for this area because I don't want to do that anymore. It was not fun. So something like as small as like a small bump to your back, your brain goes, oh my gosh, this is awful. This is exactly what I remembered last time. We are on high red alert because I don't want to experience this chronic pain again, but it's kicking in all of these, this whole system all over again, and you're experiencing, oh my gosh, this is the same pain. It shouldn't be the same pain. That has healed already. But your brain thinks, once again, we're back to this really big injury. Also, if you get really stressed out, your body's releasing these chemicals, which were the same chemicals that it released when you were stressed out from the original injury. So your brain, once again, recognizes those hormones and goes, this is the same injury all over again. Send out the red alert, like we are on high alert because it's back. And your brain just kind of assumes that it's coming from that area. And it might not even be coming from there at all. It could just be because you had a breakup or you had a really poor score on a test. Somebody yelled at you at your work. So these kind of things are all playing into it. And unfortunately, pain is a really complex process, and sometimes the brain gets it wrong. But that doesn't mean what you're feeling isn't worthy of being treated or isn't real. It just means that we need to kind of attack it from a different aspect than we would, I fell and I hurt my back 2 days ago. Those things are they're different, they're treated differently, and that's why we're kind of going over this today. So on that note, I have a few tips on handling chronic pain. Before I tell you those, I want to place this caveat though. If you're weary of performing anything that I say next, or you just don't want to do it without somebody there, don't do it. Reach out to me or another healthcare provider so that we can get you on a treatment plan that's right for you. So, exercise is my first tip. I know it's a dirty word, but stick with me. Gentle strengthening, stretching, and cardiovascular exercise have shown to be significantly affect your perceived pain as well as your physical function. Now, if you have not exercised in 3 months due to chronic pain, you don't know where to start, you're afraid you're going to make your pain worse, or you're just not sure where you're having pain to begin with, speak to a physician, talk to me, let's get figured out what's going on before we just jump you straight back into exercise. The next step is really simple, and it's actually pretty profound once you start getting into it, and that's mindfulness. I need you to stop, take a breath, let's do some deep measured breathing. Let's take an inventory of your body. Close your eyes, figure out what you're feeling, where it's coming from, and accept those emotions because they are real. What you're feeling is very real, and it's okay to be in pain. It's okay to be scared. It's okay to be stressed out, but it's not okay to stay there. Once we start, once we recognize these, when we accept these things as real and begin to work on them. The next things you can do are really simple, is trying ice or heat at home. If you have swelling or lymphedema, you need to talk to a physician first because we don't want to make that worse. Also, you need to make sure that you're always checking your skin because ice and heat can both cause burns on your skin. And if you are confused about how to use ice or heat, let me know. I'd be happy to talk to you about it. The last thing I want to talk about is for you guys to actually talk to somebody about what's going on. I need you to talk to them about what's going on, your feelings, how you're handling it, how it's affecting your life, because your mind health, your mindset, what's going on in your brain has a very large impact on how you're perceiving and handling pain, as we talked about earlier. So friends, that's all I've got for today. If you want more information on chronic pain, or you think you might need some more tips and tricks, I actually have an ebook that's coming out at the end of this month that I'd be happy to give you. If you want it, leave me a comment, shoot me a funny emoji, text me, message me, go on rechargeperformancetherapy.com, let me know that you want it. As soon as I get it, I can email it to you. I just don't have it back from production yet. So this has been another episode of Your Sunday Special. I'm Dr. Paige Hubert for Recharge Performance Therapy. I'll see you guys next time. Bye!